All right, Nico, can you say, welcome to another episode of Healthy Births, Happy Babies?
It's a happy episode. Happy babies.
Hello and welcome back to another episode of Healthy Births, Happy Babies. I'm Dr. Jay Warren. I am your host, as well as being a prenatal and pediatric chiropractor here in San Diego, California at the CAP Wellness Center. And on today's episode, I'm going to have a conversation with Dr. Tate Gentile. He is a chiropractor now out in the Big Island of Hawaii. He used to practice out in Colorado, and in starting his practice on the Big Island there recently, he's seen a big difference between those two areas. And this episode isn't necessarily going to be about practice management. It's not going to even be about Colorado versus Hawaii. It's going to be about the difference between access to care. It's going to be a conversation about birth education, because as a prenatal and pediatric focused chiropractor, that's who he's working with. And it was very different, the people that he was helping in their pregnancy and starting their families and in their birth in Colorado versus what he's seeing in a more rural setting, if you will, in the Big Island of Hawaii. So it's a call for getting yourself educated, knowing your choices, and he's going to bring that perspective of going from a city where there's a lot more access and a lot more ease of getting to education about birth and about parenthood, and then going to a more rural setting where there's just not as much available to you, and you have to be much more proactive. So I'll have you listen to this short message. I'll introduce him to you, and then we'll switch over to our conversation in just a second. My online course, Connecting with Baby During Pregnancy, has been out for a while now, and I've been getting phenomenal feedback from you women who have been learning these prenatal bonding techniques, putting them to use, and having amazing results. The same kind of results that the women in the Rafi study were getting, where by doing these techniques throughout pregnancy, they were having less anxiety and pain during labor. They're needing less obstetrical interventions, including less C-sections. And then afterwards, the babies are sleeping better, which means you're sleeping better. And postpartum depression was less than 1% in the moms who did these techniques. So go over to my website at drjwarren.com/CWB and learn all about it. I think this course is amazing. I put a lot of effort into it, and I think it'll really help you have a healthier, happier, and more relaxed pregnancy and a gentler yet powerful birth. All right, my guest today is Dr. Tate Gentile. He's an upper cervical focused pediatric and family chiropractor serving the Big Island of Hawaii. His undergrad in exercise and sports science was completed at Oregon State University, and then he graduated from Parker College of Chiropractic in 2007. He practiced in Fort Collins, Colorado for 8 years. Then he joined the faculty at Sherman College of Chiropractic as an associate professor of clinical sciences from 2015 through 2019. Dr. Tate earned his certification through the Academy Council of Chiropractic Pediatrics in 2018, and now he practices on the Big Island of Hawaii with his wife. In his free time, you can find him enjoying the outdoors, camping, fishing, working in the garden, and coaching CrossFit. So with no further ado, let me switch over to my conversation with Dr. Tate. All right, Dr. Tate, welcome to the podcast. Thank you for joining me today.
Thank you very much for having me.
Yeah. Well, it's we're across the water from each other. I'm here in San Diego. You're in beautiful Hawaii. You're in Kona. And you just started your new practice out there. You've been elsewhere, and that's kind of what we're going to be talking about today, like differences you've seen in the birth communities there. But before we jump into that, like tell people like how you got interested in what you're doing, one with kids and pregnancy and the ICPA, and then how you came to be in beautiful Kona.
Yeah, all good questions. And I guess early on in practice for me, I first started practicing chiropractic in Colorado. And early on in practice, I just found that I really resonated with kids. And I think what it was just that playful energy and environment, and just seeing the light in the kids' eyes that would come in, and then also seeing like kids that were challenged as well, and knowing that they had a much better life potential. And so that's kind of how I got started, and started diving into the ICPA and taking classes. I've completed my certification, pediatric certification with them a few years ago, and it's been an awesome experience. So yeah, I practiced in Colorado for 8 years. My wife then decided she wanted to become a chiropractor, so we sold the practice, moved to Spartanburg, South Carolina, where she went to chiropractic school. I took the opportunity to teach there along a few other great ICPA instructors. And after she was done with her time at Sherman in Spartanburg, we moved to, we're in a small town north of Kona called Waimea. It's about 12,000 people here. And we're looking to create a hub of healthy families, babies, and pregnant moms here.
Very nice. Well, and it sounds like that area needs it, from what we were talking about before. And reason why I wanted to talk about this topic is it's a very different from your practice in Colorado. You're in Fort Collins, right? And
right.
Going from there to Kona, I mean, one, mountains to beach is one thing, but as far as like, I don't want to say the consciousness, but like the availability of healthcare is something you've seen is different, and just even the whole paradigm of it. Can you describe what you've found different?
Yeah, so in Colorado, Fort Collins especially is a very progressive city. Lots of access to really great healthcare, alternative healthcare, pretty much whatever kind of end of the spectrum you feel comfortable moving into your birth and delivery process is there for you. So I had a great experience learning about lots of different avenues of birth in Colorado, and shifting here to Hawaii. It's a bit more rural of a setting. Like I said, we're about 12,000 in population here. The two big cities near us are Kona and Hilo, which are both about an hour away. And, we have pregnant women driving from, an hour and a half, 2 hours away just to come to our office, because we're the only, my wife and I, only certified Webster certified doctors on the island here.
Wow. I mean, and that's something that, for other areas, it's like, say for me in San Diego, like there's a lot of access and It's a matter of choosing which one rather than having to drive like hours to get that kind of care. What have you found as far as like difference too about like pregnant women in like the options that they have like with birth providers? Is it mainly because it is more rural? Is it more like home birth oriented versus hospital, or is that not the case?
So there's definitely on island here, I've met a few midwives, and a lot of them are actually not practicing anymore. So seems to be that there's a need for the midwives in the home birth world.
Yeah.
But also there's not like birthing centers throughout the island. In our town happens to be the most, desired place to have a baby here in Waimea, because the hospital has probably the best resources for all of the island. And this is, although we're an island chain, it takes about 4 hours to drive to the other side of the island. So people, if they have access and the means, they will come here. But that means, coming to your doctor checkups from 3-4 hours away.
Wow.
And So what we found, is that there's a lack of doctors here, and then also on top of that, just creates a need for more holistic, alternative-minded doctors as well.
Right. Well, and especially in the like in the birth community, like that's a time where you're hopefully doing a lot of access, like being checked regularly to make sure everything's healthy during the pregnancy. Is it something that you've only been there like starting to practice a couple of months, but like is it something that's part of life there? Is you drive long periods of time to see all these appointments, or are there not as many appointments because it's just too far?
Yeah, that's a great question. I think part of life here is like it's almost going back in time a little bit, to where you just do what your doctor tells you to do. You show up for your OB appointment, and they say, "Yep, looking good. Come back next week," and you don't really know what you're getting out of this. And unfortunately, I think a lot of women kind of fall into a system where they're not being empowered with knowledge and resources to give them and their families the best decision possible around, the birth of their child.
Mm-hmm.
And so I think, we are just really trying in our office to create this hub of and a resource for good information so that these families can make better decisions with better information.
Right. And you had described, I would love for you to recount the story, like the birth class that you and your wife went to and that experience. Can you retell that?
Yeah. So my wife and I are trying to explore the area for, just to see all the birthing resources. And there was a birthing class being offered on the weekend. And so we signed up for it. It was a 4-hour class, and we showed up, and there was a few nursing students there. And also there was a couple that was pregnant. And, I guess just walking into the space, I didn't really have any expectation and was trying to maintain an open mindset. And what I found was, probably just a little bit different than my personal philosophy around, what bringing life into the world looks like for me and my family. And it was a little bit scary. I mean, there was definitely fear involved. It was all of the things that could potentially go wrong in a birth, all of the various diagnoses that, could come up, red flags of what to look for. And it was definitely not like the most empowering thing, especially if me and my wife did happen to be pregnant at the time. It wouldn't have been, walking out those doors the most exciting time of our life.
Right. Just more fear-based than anything else. Was it mainly to kind of let you know about those red flags so that you go to your doctor and make sure that they're taken care of? Was it anything in a prevention sense about like how to be healthy during the pregnancy, or?
I think what I took from it was that there is people, and the nurse that was teaching this class, she's wonderful. Like she's a great nurse and doing exactly what she's supposed to do and wanting to help as many women have best birth and that they can. And what I found or learned, I believe, is that like people come into the hospital and they've never heard of various things. And so what this nurse was trying to teach the community is when you're pregnant, and you come into the hospital, this is kind of the process, and this is what's going to happen. And this is, you can become more aware and get over some of your fears by learning how this process kind of works and things that you can kind of expect.
Got it.
And so it was definitely an interesting take on the educational process.
Right. So it's much more like a class on how to be a patient rather than like, these are your options during birth. And like, you may want to decide to do this, do that.
Right.
Am I right? Like you had said before too about VBAC, the VBAC isn't done on that island?
Yeah, this whole island. And I learned that in the class. So that was definitely a benefit of going to that class, that, VBACs are not performed on this entire island. And the reason is, I believe, is because they need to have an anesthesiologist present for a VBAC. And being that there is a shortage of doctors, there isn't always an anesthesiologist present in the hospital. And that's the reason. And so a lot of these women who are requesting a VBAC get sent to Oahu for that, which is, probably not the most ideal if you don't have the means to put yourself up in a hotel and, during that time when you're wanting to have a baby, in the comfort of your own home.
Wow. So is that something so I would imagine like many women wouldn't even know what a VBAC is because they just assume, okay, I had one before, and then I just keep doing them, not even really understanding that doing a vaginal birth after cesarean is something that one can be done or could be done if they were in a different area.
Yeah, it just kind of turns into like not an option.
Yeah.
Here.
Right. So what would you say, so having that difference of, okay, these are the availability, the education, not education like in a schooling sense, but knowing about birth and options, and like in Colorado versus here meaning what you being in Kona, that is kind of inspiring you and your wife of like, this is what these women need to know. I mean, obviously like educating them about VBAC isn't necessarily the best way of going because it's not even an option for them. But what other kinds of things are you seeing that are so maybe commonplace or was expected in Colorado it becomes your job now in a more rural setting?
Yeah. I think just the concept of, when when a woman gets pregnant, just them having the ability to see what's best for the overall outcomes, or, trying to avoid intervention. One of the things, with the Webster technique is, just creating balance in the pelvis and sacrum, allowing the nervous system to be able to communicate with the body, the muscles of the pelvic floor, the baby, and just creating really great neurobiomechanics within the pregnant woman's system can really decrease the overall need for intervention and just put the woman's system at ease. So, being Webster certified, my wife and I here, we're just trying to get that word out. And I think that's like a great place to start. Another thing that we're doing is we're creating a group of women to be able to come to our office and just like share their stories. So it's almost like a kind of a grassroots movement for mothers, pregnant mothers, nursing moms, mothers that want to have, or, women that want to have babies, to come and share their stories about their birth experience and just empower each other. And that's really, the direction that I see our office going, and started to change the kind of mindset around birth here a little bit.
Right. I think that's so powerful because one, powerful for the moms that have already had babies and they can retell their story in an effort to like educate and help other moms, but like it anchors that into them so that it really becomes part of their own experience. And instead of, if it is the culture there right now that it's medicalized, it's going to go sideways, you're going to have to be saved by the doctor type of thing, that it almost, that story can be ingrained in them. But if they tell it over and over, it can be like remembered in that way. But then obviously like having other women who are interested in maybe doing things a more natural way and not the way the birth class said, they get validation that others have done it, and hearing stories from others so that it's more possible for them, that's more likely for them. And they well, one, I mean, just how many VBACs that you could prevent, but there's, or how many other cesareans, I should say, that you'd be preventing because the first one went well and the
Right.
birth went as designed. So I think
Right.
that's key as a community build to create within as part of your hub of a place for women to go that want to find out like what that natural birth process is like.
Yeah, that kind of reminds me of this experience that I had in Colorado, actually, where my sister-in-law was pregnant at the time, and I was talking to a little girl that was in my office, and I think this girl was like 6 or 7, and I said, "I'm gonna be an uncle," and she said, "Well, is it is it going to be a boy or a girl?" And I said, well, I don't know. And she was very confused that I didn't know if it was going to be a boy or a girl. And then she asked me, well, when is its birthday going to be? When is it going to be born? And I told her, well, I don't know, whenever the baby's, ready. And it just kind of like woke me up to this idea that, there are little girls and kids today that see, their baby on this three-dimensional, ultrasound. They know exactly what sex it's going to be. They know exactly when it's going to be born. And that's just the norm of today's kind of medicalized birth. And, birth only happens like so many times in someone's life. And it's this like magical kind of mystical, empowering experience. And I think it should be, continued to be left in that realm. And so that's really what we're hoping to bring back, that magicalness of birth here, and decrease the fear in women's lives, and just kind of set their system at ease a little bit with the work that we do.
Very good. Well, I appreciate the work you're doing. Tell us, or tell the listeners, how they can get in touch with you if somebody's listening on your island, where they can find you, and then also just other people that might be interested in what you're working on there.
Yep. So we're on the Big Island of Hawaii. We're in a town called Waimea, and the name of our practice is Atlas Pacific Spine Center. And our website, I guess, is www.atlas-specific.com. And we, if you have questions or anything, we'd be happy to point you in the right direction, even if you don't live on this island.
Great. And I'll put that link for you listening. I'll put that link in the show notes. So you have it. You can just click over and get in touch. So Dr. Tate, with our last minutes here, like what's the major take home that you'd like a listener to take from what we've been talking about? It might be something we've already talked about, you want to reiterate, or maybe something new we haven't gotten to yet.
Yeah, I think the biggest take home that I want to just try and get out there is that ultimately, when it comes to birth, you and your family are responsible, for your birth process. It is not up to the doctors. And I want people to feel empowered both males and females, husbands and wives, in their decisions around their family and their child's birth. And that way they just, take total control of it and, exhaust all of the resources and avenues to get, the best answers so that they can make the best decisions possible.
Very good. Well, Dr. Tate, thank you for doing what you do. I appreciate you helping those out on the island. And, we've come in contact through the ICPA and a lot of the courses that you're teaching online. That's going to help a ton of people also. But mainly, congrats to you for being in such a beautiful spot and spearheading something that could be really impactful for everyone on that island. So thank you for being here, Dr. Tate.
Hey, I appreciate you having me on. And next time you're out here, come swing by.
You betcha. I certainly will. Thank you. Hi, it's Dr. J again, and I want to thank you so much for listening to the podcast. It's something I really enjoy doing, and I, as a parent, learn a ton from these experts coming on and sharing their wisdom, so I hope you're getting a lot out of it too. And I want to share something else with you. I've created a guide called the 40 Ways to Connect with Your Baby During Pregnancy. It's full of simple things you can do on a day-to-day basis that will help strengthen that bond that you have with your baby. It's a free download. You can go to my website at drjwarren.com/40ways and just enter your email. I'll send it right to you. You can download it and start working on it right away. All of the research that I'm learning in the fields of epigenetics and attachment parenting is showing that the more bonded you are during your pregnancy with your baby, the better the birth is going to go and the better parenting is going to go, because you have that strong foundation, a strong connection to build upon. So go again to my website. It's drjwarren.com/40ways and get that free guide. And again, thanks for listening.